this.
Yeah, I can go a decent way with that.
Okay, and then if you go palm down and continue up further, does that also get that broad spread limitation or pinpoint?
That's all there.
Okay, great. Let's have you lay face up here. So let your arm just rest against me. Okay, that's good. Let everything rest here. Okay. So the great thing is there's no like sharp pinching right under the acromion. What's happening is when we get to the full end range of motion, there's stress in the capsule around the shoulder.
Right.
And that's what's creating the capsular pain or the broad spread pain versus the single spot. So that's
right, and it's just that residual little bit kind of.
That's right. Is that tolerable at that level? So this first point is the anterior deltoid and the tendons of the biceps. And these can create limitation with flexion of the shoulder. The radial shockwave therapy produces a sound wave that we can target tissues in the first 2 inches of depth. And our focus machine is more like a laser pointer. It finds the specific parts of the deep connective tissue that are limited. Still tolerable at this level? Okay. Okay, this spot's kind of neat. I'm seeing a fasciculation in the tissue. Right when I roll over it, we get to that. So does it feel different when I'm on that spot? Just locally, it's a little bit more, or does it travel as well? Locally, okay. Good. So I'm watching the way the connective tissue and muscles respond to the treatment. We should get this fasciculation within the tissues in the tightest areas. And just like dry needling therapy, when we use the shockwave therapy through those tissues, there's a reset in the Golgi tendon organ. That's like the pressure setting inside the muscles. And as that fasciculation starts to decline, we get a lower resting tone within the muscle, a little easier to move into flexion. Still okay at that level, or take it down a bit? All right. Okay. All right. So I'm going to take you through a shoulder range of motion while we're applying that therapy. So let's go from here to here. How's that level of, that's good, not too much. Still tolerable there. So for this one, we want to get a little more internal rotation. So from this position, I'm going to have you rotate your arm down like that against my resistance. So rotate down, great. Go a little further, nice. Don't let me pull that back up. Okay, go a little further. Nice. And bring that arm back. And again from here, rotate down. Good. A little further, rotating down. Great. A little further. Nice. Let that rest now. That's great. as well. And that's why we get such quick results with Shockwave that are hard to obtain in other non-surgical approaches for frozen shoulder. Okay, we're gonna get you back to laying face up so we can use the focus therapy right through the front. That's good. Okay, let's bring your arm to here. Now we're gonna treat in the axilla, right on the under surface of the capsule. Through that barrier of abduction. And if it's a little too much at any point, just let me know. Go a little further. Still tolerable there?
Yeah.
Okay. Any pinching or just that widespread ache?
Just a widespread ache.
Excellent. Go a little further here.
Have you take a deep breath in for me? And blow it all the way out. Excellent. Breathe normally. How's this pressure feel, Adrian?
It's okay.
Get your back now. Turn out to your side, facing away from me. There you go. And scoot to that edge of the table, please. A little bit more. A little bit more. Straighten that leg. And this one right here. Right here. Like so, hold on to your arm right there.
Oh, this
Scoop
one.
it. This one, yes. There you go. Face up on your back. Guy gets looser every time. How's that feel right there?
It's a good 10 minutes. It's okay.
Dr. Fergus tells me you already tractioned your shoulder today. That pressure okay for you, Adrian? Adrian's all ready for you
Alrighty.
for that shoulder mob.
How are you doing today?
Good. You?
Perfect. The squad. How's it feel? Your time in the limelight right today, right?
I wasn't planning on being in the limelight. Well, look.
From the camera? Yeah, where do you want me to go?
No, I want to make sure we're away from the camera. It was just randomly facing over here.
Okay. We'll start with the. Let's see. It's funny. We'll do some of these just to start quick today. Your faves. So yeah, start with.
Do that.
Yep, the one hand.
That one.
Yep, and up like that. We'll do like 5, and then you can switch the grip. Nice.
Wow. It's better, isn't it?
Yeah, that looks really good. Nice. Good. All right, yeah, switch the grip. Perfect. Does that feel a little harder kind of with that way?
That's always been the harder one, but it's
Yeah.
not.
I mean, that looks a lot
anything
better.
like as bad as it's been.
Oh, that's way better than it
It's
was.
way better.
That looks pretty good. Nice.
It's gone a long way up now.
Good. Maybe last one like that. And then we'll flip. So then you're bringing it kind of like you're raising the flagpole. So
Like, this
yeah,
way around.
flip like that. Yep.
And same thing.
Yep, same thing.
Start that way around because we're
You
there
can
already.
start, yeah, whatever grip you want. And then we'll flip it after 5. Good. That looks better too. Yeah, you're like, I know.
It's a whole bunch better. Because the reverse grip was the more of the issue.
Nice. Sweet. Very good. Couple more here. There you go, nice. All right, let's do the rings next. Use this one. Just gotta start. You just got this down, you're just easy to coach through it.
Yeah, we're doing it a bit now, right? So let's do it like that.
Yep, we'll do it. Let's do 10 like this, and then we'll do 10 kind of the opposite motion. Nice. How's that feeling?
Good.
Good? Good. That looks great. Good. Nice.
I reckon. Unless you're counting.
I think, yeah, you're right, you're right. Okay, good.
Change the grip, what, to under grip?
Yes, for this one you start like away, and then when you turn in, it's kind of like,
So I start there
yeah,
and come to there. Yep.
Alright,
There you go.
good. Now I think we gotta show the camera how good you are at the overhead one.
All that.
Let's switch right here. All right, so yeah, bringing it in. You got it. Bringing it up.
Right.
You gotta show.
But I have to do this. That right. It's like, it needs to be up there somewhere. But that needs to drop.
Yep, keeping this nice, relaxed, slow, not getting that shoulder hiking up.
Which is always the challenge.
Yep. Good.
Tell me when it stops. And then we do some of those, right?
Yeah.
I do that.
Yeah, keeping this nice and low and try not to let that shoulder kind of, don't let that torso kind of rotate back as you bring that arm back. So I'll kind of push right here so you're not coming back this way. Can't cheat, right?
Yeah, it's easy to be having someone set it in a position. It's like,
Yeah, keep that nice and relaxed. Calm through there. Good, nice. Good. Let's try it without me pushing it back. But yeah, try to keep this without kind of pushing back this way. So keep it nice. Good. Nice. Now what I'm gonna have you do is slowly start turning your head. You can look towards me this way. And keep this nice and neutral, relaxed. Good, and I can go back to looking back down. And let's go the other way. Good. Yeah, and keeping this nice and high through here, not letting that kind of collapse down. You're doing a good job of that. Good. And we'll do one more each direction here. Good, and then try not to let that, yeah, kind of keep that neck nice and neutral there. Good. Nice. Good. You can take a little break if you need it. How's that feeling?
it's okay.
It's okay?
You know, it's
Not
under
too bad.
strain, but it doesn't, you know, there's under strain and pain, right?
Yep.
Those are two slightly different things. It's okay.
Not too bad. All right. Now just making sure to keep this
That
nice
high.
and high in there. That's the hardest part, right? Because
Right.
we want a tendency to just have that drop down there. But
Right.
take a little rest if needed.
Right.
Good. And then what you're gonna do is you're gonna kind of push, so maybe bring these in a hair closer. There you go. So then push with your elbows, kind of push forward to kind of push yourself back onto those knees. Looks
Like
like you're
that.
kind of, yep, rocking back. We want to keep this neck nice and long and neutral here, keeping this high, and then come on forward again. Big thing here is just, we don't want to, want to keep that neck nice and aligned. You don't want to get too much of that extension, so kind of keep that almost like a little chin tuck, keep that engaged. Good, come on forward as far as you can go, nice. And then rock on, keeping this long, straight through here.
And now go back again.
Yep, go ahead and back. Bring that on back. Making sure not to kind of let this fall, so keep this all high through here. And that's fine. Alright.
And then come
Good.
back.
He's looking good. A lot of progress, which is great. Yeah, but this is kind of falling, so remember to keep this. I know this is hard. You can take a little break if you need, but
Extra scap. You haven't done that yet, right?
No.
Okay.
You mean-
Anti-humerus, laterohumerus, all for me. Perfect. Okay. All right, let's, it's kind of weird I'm wearing a turtleneck. It's hard to get this thing attached here. I have something fuzzy. Let's come on over here, back to the wall. And we're gonna do some laterohumerus.
That's
Yeah,
you mean
yeah,
that.
yeah. Okay,
This one. That fella.
that fella, right. So nice goalpost position, good position there.
This
Remember, yeah, this fellow. Keep that head alignment here.
You mean and this one? Like that.
Yeah, yep. And bring it on back, right. So come on out with that, right. As you come out, let this open up a little through here, whole body. Let this whole body open up through here. Your head, let's just keep that head in alignment. Yeah, and bring it on back. And then come on back forwards. I know I'm being all nitpicky. Everything stays in alignment. Come on out. Nice. And back.
Do that and then do that.
Yes, exactly. Good, good, good. Nice extension through there. Good job. Let's go to extra scapula. Your favorite, yes, on the floor. I'm gonna get a pad here for you. I'm gonna move this out of the way. Okay, first, let's see where you're at with that. Look how close that is. We're gonna just nail it down.
That would be
All
good.
right.
Good.
Do you want the pad? I'm gonna have you do some on your own first.
Let's see where we are.
All right, you want the resistance band? Oh, it's piling up there. All right, come on back.
See, that's what
Let's
happens.
do it this. Okay, you're gonna do a few on your own without my assistance. Let's just say we're gonna go through 4 without my assistance. Nice, you wanna try to really pin that down. Still much better. Yeah. Go again. Let's say one more on your own, and then I'm gonna come and give you a little bit of help. Nice job. Okay, are you ready for some help? We're gonna get rid of this, aren't we? Bring it nice and down. I'm gonna go, we don't even, yeah, we'll keep that. Bring it up to here. A little stiffer today than last time. Can you come a little lower? Well, we went through a lot today too in your other treatment. Ready? Let's go. 1, we're gonna do 5 here. Still much better than a pile of law books. 2. There you go. 3. Let's do a little repositioning here, back to that goalpost position. And 4. Someday you're gonna be flat on that floor. Let's go a little lower right now. 5, nice. Give me 2 more like this. Look at that, you're actually almost on the ground here. Up. And roll that on out. Oh my gosh, look at that! And then bring it on back down. Yep. 2. I'm gonna help with just a little extra extension here. Give me a couple of arm circles up here. Yep. And down. Nice, nice. Drop that shoulder a little. There you go. So relax through that shoulder, relax through that shoulder. Back off just a tad here, so relax here a little. There you go, now give me some circles. Good, and back down. You can do that same thing. Nice, much better. Can you go a little more? All right, right there. A couple circles, good. And then bring that on down. Yep. Relax through there. Nice. Nice. I'm going to take that away. Good job. Let's say. Nice. Nice extension through there. Okay, give me one more. Yep. It's like you're going bowling. Although when you go bowling, they say thumbs up. We're not doing thumbs up.
I'm playing cricket because I'm English.
2. Cricket. Keep that nice shoulder extension, yep. So you're starting to lean over this way, which gives you this little advantage like that. Keep it square. Beautiful. Okay, let's say 3 more like that. And 1 more. Barely caught that. No.
My name's Adrian, so I came to Cornerstone, I'm guessing about 2 months ago, because I'd been experiencing some discomfort in the upper right arm for a period of time, and I didn't think much of it. I just thought it was just one of those things, but it kept persisting. It was affecting my sleep at night. Lying on it was a problem. I was beginning to lose motion in the simple things like, pulling off a t-shirt was affecting it. So I thought, I really better get it checked out. I don't think it's much, it's tolerable, but there's definitely some restriction in very basic movements, certainly above that kind of level. So that's what brought me here in the first place. I think pretty much right away. I mean, the first week I came, I had diagnostic, and then we scheduled a couple of sessions pretty quickly, including with Liz, to start doing basic homework exercises. And I think through doing the various exercises, I mean, within a matter of days, there was already, some improvement. And then what I found is that you'll improve, and then it'll plateau a little, and it'll improve again, it'll plateau a little. It's like kind of going upstairs gradually, but all the way through. That's been the process. It's always felt like there was some improvement week on week. I mean, I think one of the things that I've learned 30 years into a very sedentary career, so I came in thinking, maybe I tweaked muscle, just doing some very basic weights, and then sort of discovering that actually what was going on here was really sort of a product in part of being, sat at a desk most of the time, hunched forward, perhaps not great posture, and that all these things over a period of time have a cumulative effect was initially a bit of an eye-opener, but when I thought about it, made more sense. And certainly so, through the process, realizing, that what seemed like it was just some mild aggravation was, actually a bit of a problem, and then actually getting it sorted out, and also thinking about, how I can stop it recurring in the future. All these things have been extremely beneficial. Shockwave is, I can't say that it's enjoyable, right? Because you have to kind of decide where your tolerance is, but certainly I think it's been, extremely helpful. You can tell initially it's going to feel a bit stiff after a session, but as the days go by, you start to feel the benefit from it. And the other thing about it that's interesting is that as things improve, the Shockwave really helps to kind of locate where the residual issues are, so you can pinpoint pretty effectively and then concentrate on where you need to concentrate on, which again, kind of stepped effect, that means you feel like you're constantly making progress.
This is Dr. Fergus with Cornerstone Health. We just wrapped up a case of adhesive capsulitis or frozen shoulder treatment with Adrian. If you have stiffness in the shoulder or have been diagnosed with frozen shoulder, give us a call and we'd be happy to help. Also, click like and share on this video for your friends that might be looking for a similar treatment.